Good morning, everyone. Happy Friday, and welcome to the virtual teacher training presented by Black Women's Mental Health Institute and the Black Belt Community Foundation. We're so glad that you all are joining us today on this wonderful Friday. Hope you're feeling good, you're looking good. So let's get started. Um, I'm going to go over our agenda for the day, and then I have a little icebreaker. So, our day is going to go like this. We're going to start out with a welcome, which is what I'm doing. Again, my name is Lauren Packer. I'm a therapist here in Alabama and a part of this Black Women's Mental Health Institute team. So, after we do our welcome and our icebreaker and our house rules, we're going to hear from Dr. Nadia Richardson. And then you guys have the honor of doing a couple of fireside chats with some powerful and amazing individuals. We're then going to take a short 10-minute break, and then you're going to hear from Dr. Artie Nelson, a child and adolescent psychiatrist here in Alabama. And he's going to talk for a while, and then we will open up for questions and comments, and that will be our day. So if you have any questions or anything to say, drop it in the chat, and we will do our best to answer you. So let's get started with our icebreaker. Our icebreaker is a this or that challenge. And so, what I would like for you to do is when it pops on the screen, figure out, do you prefer this or that? Do you prefer sunrise to sunset, sweet to savory, the sun to the moon, early birds to night owls? I'm an early bird myself. Do you want to take a risk? Do you want to just relax? Do you want to go to the park? Do you want to stick your feet in at the beach? Family time or me time? That's a tough one. Do you want to go to a bar or a cafe? Do you prefer to do things yourself? Do you prefer to buy things? Are you into TV series or are you into movies? So let me know which one you prefer, this or that. I know me personally, I am all about anything relaxing. So the beach, just relaxing. Me time, that's a hard one because I have a family. But me time, I prefer to buy things, and I'm really in a different series right now. So, what are your this or that's? So, I'll give you a couple of minutes, and then I'm going to introduce Dr. Nadia Richardson. And while you're doing your this or that, I'm going to go ahead and go over our house rules. Number one rule, have fun, engage. We love participation, comments, questions, all of the things. Rule number two, make sure you are super comfortable. Grab your cup or your coffee, maybe something to write with, get your comfortable spot. If you're at work, get in that good space because today is going to be amazing. Rule number three, don't be afraid to step off to go handle business. And rule number four is this is absolutely a safe space. So, we want you all to feel comfortable and we want to welcome you in. All right. Oh, I got somebody who prefers to just relax. Yes, girl. Yes, just relax. Buy things over me time. Okay, I love it. Somebody said that. Yeah, these this or that's are interesting because sometimes I'll DIY, but sometimes I like to buy things. I'm all about paying for the service. Just relax. I love it. I love all these this or that's. Sunrise, early bird, savory, just relax. Beach bar, sun, me time. That just sounds like a vacation, Lizzie. Sunrise, savory. I love all these early birds. How early are we earlying early birds? Are we 5 a.m.ers, 6 a.m.ers? A little bit of this, a little bit of that. I love it. Okay. I love it. Family time and movies. You guys got some good this or that. TV series. Okay. Beach and family time. I'm with that. And squeeze in a little me time with that one too. Family time. You guys are doing awesome at this icebreaker. Okay. So Sunset. I love it. All right. So while you guys are finishing up your this or that, I'm going to go ahead and introduce Dr. Nadia Richardson. She is the CEO and founder of Black Women's Mental Health Institute. So you all enjoy. We're going to have her unmute for a second before she gets started. And as always, if you guys have any questions, again, feel free to pop them in the chat. There you go. All right, here we go.
You see how excited I
Again,
am to be
Dr.
here this
Nadia
Friday
Richardson.
morning. So excited that I can't even remember to unmute my camera or my phone. Okay, how is everyone doing this morning? My name is Dr. Nadia Richardson. I am the founder and CEO of the Black Women's Mental Health Institute. And if you can't tell, I love doing this work. Why else would I be this chipper on a Friday morning with only just one cup of coffee? So I am passionate about mental health equity, mental health access, and the great state of Alabama. So being able to do this with the Black Belt Community Foundation, targeting Alabama teachers that serve the Black Belt, as well as teachers throughout the state, is really exciting to me. And I would actually bet, because we have a national reach, that we may even have a couple educators here who are not from Alabama. And we welcome you, and we're very happy and excited to have you here today. So one of the things I love to do, as someone who is the only person on our team who is not a licensed mental health professional, but an educator and an advocate, one of the things I love to do is to be able to talk to individuals about their mental health journeys, their mental health work, and their mental health advocacy. So I'm really looking forward to kicking off today's webinar with two conversations with two individuals that I admire and who are doing very important work. What I'd like to do now is welcome JacQuan Winters. He is the founder and executive director of the Kristen Amerson Youth Foundation. Come on in, JacQuan. Hey.
Hey there.
Good morning.
Good morning. How are you?
I'm good. I'm good. Thank you so much for joining us. I became familiar with your work years ago, and I try to take advantage of every opportunity I can to work with you, to partner with you, but really just to highlight the fantastic work that you're doing. So, can you tell us the mission of your organization?
Yeah, absolutely. First, thank you for the opportunity to share on your platform. So, to tell you all a little bit more about the Christian Amerson Youth Foundation. So, our organization is a nonprofit organization here in Tuscaloosa, Alabama, with the mission of promoting healthier lives for youth by providing age-appropriate resources for suicide prevention and positive educational experiences. I have the opportunity to serve as the executive director as well as the founder of the Christian Amerson Youth Foundation, and the whole purpose of why the Christian Amerson Youth Foundation was created was to continue the memory and legacy of Christian Amerson, who died by suicide at the age of 11 in 2014. So, with that in mind, we wanted to be able to help children and families in Tuscaloosa to not suffer the same fate as Christian. And I was blessed enough to be Christian's oldest brother. So that's the reason why we were created as an organization.
And that's actually one of the reasons I love to highlight your work, because you have the lived experience of having lost a loved one to suicide, but also someone that was so young. As you know, and I'm sure many people on this webinar today may know, is that the Congressional Black Caucus did a task force and a report called Ring the Alarm, and it focused on the rising statistics around Black youth suicide. And it struck me specifically because quite a few of those losses came from our state. There were two young ladies that we lost to suicide at 8 years old, one at 15, some from Madison, Alabama, some from Huntsville, Alabama, and they received national attention. So when that study came out, I really thought about you and the work you're doing, but I also felt like it was important to highlight these experiences and these stories because most people were blown away that people could be lost that young to suicide or even be managing suicidal ideations. Can you tell us a little bit about the books that you've written?
Yeah, so we have two children's books. The first one is Christian's Rainy Day, and that uses Christian as the main character to teach children how to remain positive through their negative situations, and that if they can accomplish that, your rainy days will turn into sunny days. So The whole purpose of that book is to teach children that yes, we will have uh, issues, we'll have adversity, or things that we find as hard. But if we can overcome and keep a positive outlook, that things will get better. And the second book is actually My Happy Place, which is a book that I actually created or had the idea to create after speaking to a group of 8-year-olds, third graders about coping skills and bullying, and they could not understand the concept of coping. And so, me being an adult, I was frustrated. So I said, "Well, coping is like finding your happy place," and it just instantly clicked for the children. And so we put it into a book. So that book talks about emotions, but also how to deal with emotions that you don't like. So it gives a number of coping skills for children to deal with emotions.
Yeah, I actually really appreciate your books too. I don't know if you can recognize that I'm kind of fangirling over here, but I just really value the work that you do because it's difficult to have these kind of conversations with young people who are growing into a sense of who they are and even an understanding of their emotions. The good news for all the individuals who are on this webinar today is we will be giving 2 of your books away. So stay tuned, and there's a chance for you to uh, to get that book. So I really, what you just said that struck me is that your books were inspired by conversations that you had with young people. What kind of advice do you have for parents and educators and administrators on how to really tune in and listen to young people?
So I always tell people when working with children, you have to get on their level, right? So I would say first, get on their level. Secondly, build rapport with the child, that you're trying to help. Give them the platform to feel comfortable with you to open up about any issues that they may have, and just let them know that you support them through their issues and their concerns, and don't belittle what they're going through. Us as adults, we have the tendency to know that you know this too shall pass. However, kids at times they can't understand that if they're dealing with a bad grade or a breakup with somebody or having a fight with a friend, whereas that may be small to us, it's big to them. So again, just allowing them the opportunity to express how that issue is making them feel can mean a lot to them and could help them through those challenging times. So again, get on their level, build trust with them so they have and rapport with them so they feel comfortable with opening up to you, and then just again reassuring them and providing support to them.
So, can you tell everyone who's in attendance here how they can learn more about your organization, but also how educators specifically can get access to your book to have that as a resource in their classrooms?
Yeah, so we're blessed enough here in Tuscaloosa to have our children books in all of the school systems throughout Tuscaloosa County. But to learn more about our organization, our website is ChristianAmersonYouth.org. And the spelling is Kristen Amerson Amerson Youth YOUTH.org. And then we're on all social media platforms at Christian Amerson Youth, and you can purchase the books through our website. And then we also love to use our Instagram and Facebook as a resource for children. So you'll find a lot of content about our organization, but also just positivity, resources like coping skills, and just things to do when dealing with challenges.
Okay, great. Now, anyone who's on the webinar, if you have a particular question that you might like to ask Mr. Winters before we say goodbye, please go ahead and put that in the chat. I would also like to announce that we are hosting in Tuscaloosa, Alabama tomorrow at Stillman College a suicide prevention and awareness health summit. And Mr. Winters will also be there to share about his book, to share about his organization, and to just share a few words. So you do have an opportunity to meet him if you're in Tuscaloosa or anywhere in Alabama and you'd like to travel into Tuscaloosa. This is another event that's hosted by the Black Women's Mental Health Institute and the Black Belt Community Foundation. We do have a question, JacQuan, from the chat. What are some good ways that you have found to build rapport with challenging children?
So children open up to people that they can trust. So if you spend time with the kid, if you're invested in, in who they are, they tend to know that they can sense that. So I really would just say, take some time to invest in the kid. And that can be as simple as, asking them, how was your day? Um, if they're dealing, again, like I said earlier, if they're dealing with something, show them that you genuinely care about what they're going through, so that can build a rapport. Compliment the kid. When I was working in the school system, through our organization, kids take compliments a long way. That can be, I like your shirt today. Your hair is pretty. So just show that you have a genuine interest in who that kid is, and who they're destined to be, is a great way of building a rapport with children.
Okay, fantastic. Are there any other questions before we wrap? Okay, looks like we're good to go. So, JacQuan, thank you so much for being here, for joining with us on this Friday morning. I look forward to seeing you in person tomorrow at Stillman. Do you have any closing thoughts before we let you go?
But again, just thank you for the opportunity to be on your platform. I think so highly of you. So anytime that I have the opportunity to collaborate with you, I enjoy it. So thank you, and I look forward to seeing you tomorrow as well.
Thank you. Thank you. Have a great Friday. Okay, so I again appreciate and celebrate JacQuan Winters so much and the beautiful work that he's doing to remember the life of his sister. What I'd like to do now is welcome Adrienne Marbury into the chat. She is on the leadership team for the Birmingham Coalition for Youth Student Mental Health. So, hi. Hi, good morning.
Good morning.
Good. So I'm excited to have you here too. I know you've had me speak at some of your events. I love the fact that we get to collaborate and partner and support and celebrate and the work that we're doing in the community, and the fact that we're serving the entire state, but also specifically for you, Birmingham, Alabama. Can you tell us a little bit about who you are, your role, and what the Birmingham Coalition for Student Mental Health is?
Okay, so first of all, thank you, Dr. Richardson, for having me. It is always a pleasure to collaborate with you. So the Birmingham Coalition for Student Mental Health was founded in 2020, and we know what was going on in 2020. It was a trying time for both parents, educators, and the world. But what we wanted to do was to really focus on how we could reimagine what mental health supports in schools would look like. We knew the issue was there, and unfortunately, COVID exacerbated a lot of the issues that were there. One of the missions that we have is to address the mental health supports that are needed in schools in an equitable way, in a community-driven way. We wanted to talk to the community and find out how they were feeling about the supports that were available currently in schools, and what we could do to advocate for policies and for resources that strengthen those opportunities for students to have support in school for their mental health. I did want to share the results from our mental health student voice survey, because in recognizing when we talk about student mental health, we have to talk to the students. They are the ones that are experiencing these issues day to day. So I'm going to kind of walk through our latest student voice survey. And can I move my screen? Let me see.
You can move your screen. You should have the ability to do that.
Okay, let me see. Oh. Okay, so this is just kind of an overview of our survey. In 2023, we distributed this survey. We started the survey distribution in late September, and we went through December. In total, we had 453 participants in our survey. The districts and schools were selected based on interest and kind of the distribution context that we had. As you can see, we had most of our responses from Fairfield City Schools, Tarrant, and others. This year, we actually reviewed it, and we had a lot of schools that were charter schools, magnet schools, and private schools that participated in our survey this year as well. So we also had almost an equal amount of respondents from the ages of 9th and 10th grade students and 11th and 12th grade students. One thing I wanted to point out is one of the questions we ask: when something is bothering me, I have a trusted adult I can talk to. And as you see, the persons that they deem to be the most trusted in their world is parent or family members. Second to that was teachers, and then school counselors and others. Another question was: when something is bothering me, I have a trusted adult I can talk to. And then there were other responses, and I wanted to kind of show you some of the other responses. The other responses were to their friends, their no one. I just like to talk to myself. And a lot of them found that they relied on their faith, and so they would talk to God. Another question was: how often does anger, fears, worry, or sadness make it hard to concentrate on your learning and schoolwork that you have to do? And out of that, it was interesting to see that often and sometimes there is a lot of anger, fear, worry, and sadness that makes it hard for them to concentrate. So 52.2% of our respondents agreed. Are you or would you be comfortable in receiving or seeking services from a school mental health professional? 44, well, let me just say sorry, about almost half of our respondents said yes. They would be comfortable receiving or seeking services from a school mental health professional. And some of them said it kind of depended, and some said yes. I mean, said no, and then they said yes. And then what would make you feel uncomfortable in seeing a school mental health professional? One of the most interesting things I think that came out of this was that they felt that if they saw a school mental health professional, that they really couldn't help them with their particular situation, that there would be a lack of confidentiality. Others showed that there was a lack of trust, discomfort. Many said they really just didn't know how they felt about seeking services with mental health professionals at the schools. And then others were worried about their parents finding out if they had those kind of conversations with a mental health professional at school. So, which of the following would be important to change your school? To change the way that schools mental health supports and things are improved? And one of the biggest things we saw was that provide students with more resources and challenges outside of school. I always tell people anecdotally that it's hard to have a child come into a classroom and feel comfortable or want to learn if they're hungry, if home is not a safe place. And so they have to have these challenges that are outside of the school in order for them to learn in school. Other comments were they need to strengthen teacher mental health supports, offer more programs for students, create stronger relationships between students and teachers, and then hire a school-based therapist or counselor. And this I thought was really interesting. Are there any other changes you'd make to improve student wellness in your school? And one thing that we saw over and over in this survey was to have a mental health day for not only students, but for teachers, to do more check-ins with counselors throughout the year, more concentration on stopping bullying, extracurricular, downtime, allowing, we put telephones, but it's actually a cell phone within the school so that students will feel safe if something does happen or they're triggered in some way, they can call for help. And of course, there's always anecdotal things about making school better, better food and snacks, and of course, getting out of school earlier during the day. But I would love to know if there's anyone on the call that wants to, that has thought about or has had any instance where we've really thought about mental health days for students and teachers. Because as a coalition, that is something I think that we want to advocate for, as kind of normalizing the idea that everyone needs a mental health day. I mean, I'm a daughter, I have a 16-year-old daughter myself, and I tell you, there are days when she says to me, Mama, I need a check-in, I need a mental health day. And I allow her to do that because I know that's important for her, to have that space, to be okay. And I think that we need to really think about how we can take that notion and go forward with it and advocate for that. So that was just kind of an overview of our Birmingham Coalition for Student Mental Health student survey. If you want to know more about the Birmingham Coalition for Student Mental Health, we are now partnering with the United Way of Central Alabama and the Bold Goals Initiative. Our website address is BHAM, studentmentalhealth.com, and you'll be able to find more information about the coalition there.
Fantastic. Let me ask you something, because that was a lot of really great information that y'all were able to gather in Birmingham. For those who are joining us from the Black Belt or for other parts of the states, what kind of advice do you have for them for duplicating that same kind of survey in their school systems?
I think one of the things that has been the strength of the coalition is to find those champions, to find those people within your community who really want to focus on student mental health supports. I think a lot of times and I'm just talking from both a parent and a person who has worked in this space, a lot of times we kind of put it off on someone else. We may say, oh, I know we need to work on that, but I don't have the personal bandwidth, or I don't know who to talk to. But there's a whole community, a coalition that can be built in your area with counselors, teachers, parents. And I think one of the first things you can do is just think about finding those champions.
And so one of the things that I feel like I heard from you and from Mr. Winters was a call to be really transparent and authentic with students. I saw a question pop on the screen. Can we have that question pop up? This is from Robbie Thomas. I don't know if you could see it, but is this survey public, and can we find it in detail to read, or can it be emailed? So those are a bunch of questions. What I would say, just to answer that last part, is we will get that resource and make sure that we send that to everyone who's registered for this event today. But Adrienne, if you had another response for that as far as where to direct them. I know you already said the website, but is there another place that they can look specifically on the website?
So yes, there's two different things I want to point out that's on the website. One is we took the information this is our second iteration of this survey, actually, because we want to see just how things are changing. Like I said, this started during COVID. Things are a little bit different. So we wanted to see how they've changed and evolved. So we will have this posted on our Birmingham Coalition for Student Mental Health website. And what we do is also break it down by school. We break it down by geographic area as well. These survey results can be shared out. That way, I'll send the copy to Dr. Richardson and her team, and they can send it out to you all as well. But yes, it will be posted on the website so you can see it.
I will say this as well. If you're interested in duplicating this in your school systems, please reach out to the Black Women's Mental Health Institute so that we could support you in that way, because we would also be leaning on community partners such as the Birmingham Coalition for Student Mental Health to kind of support you in that endeavor. So if this is something you're interested in duplicating for your schools, let us know. Another great resource that we can provide as an organization to educators and parents and administrators is that we offer mental health first aid training as well as QPR suicide prevention training. So those are trainings that we offer through our organizations, and they're a great resource for educators. We have another question here from Lizzie Thompson. How can we change the myth of mental health and the stigma around it?
Well, I will echo our first presenter and what we found through this survey and my work. I also work with UAB Adolescent Medicine as well. People say, hey, you like teenagers? I love teenagers. They are my favorite. And so the one thing I think that is essential in any relationship building that you're having when it comes to addressing mental health, physical health, overall well-being of young people is to have trust. I think that we have to build trust with them, which means meeting them where they are. I know we've heard that before, but it is so true. It also means believing them. If they're telling you this is not a good day for me, believe them. If they're telling you that they are not safe in a space, believe them. I know it's hard for us adults. Sometimes we get in our we've got to get this done. We've got to get this done. We've got to move forward. We got to keep pushing forward. And it's very hard for us sometimes to remember there are days when it's just not a good day. And, give them grace in the same time and trust them and what they have to say. And with teachers as well, everyone doesn't have a great day. Like there are days when our teachers need to step back and take care of themselves so that they can do their best for our young people, because they are there with them every day. And as a parent, I want to say to every teacher on this call, educator on this call, thank you. Thank you so much for all the work that you do.
Absolutely, absolutely. So before I step away and close out and pass it back to Lauren, I do want to say this. In the chat, I can see a lot of people posting about needing mental health days for teachers and for students. If that is something that is not present yet in your school systems, lean on us so that we can help to advocate for that as well. Because what we can do as an organization is provide you with data, information, and strategies on how you could engage the elected officials that support your school systems to advocate on behalf of that for your school systems. So we believe in mental health days. There's plenty of national research out there to support the benefits of having mental health days. So if that's something that you're interested in supporting, let us know and let us support you in that endeavor. What I am going to do now is introduce back to you, Miss Lauren Packer of Packer Counseling. She is also pretty much the MC and coordinator of the event for today. And we are so excited to have her as a part of the clinician team with the Black Women's Mental Health Institute. Adrienne, thank you so much. We will be in touch. I look forward to seeing you soon. And Lauren, you can take it away, and I'll step away. Thank you all for joining us.
Thank you. All right, Adrienne. So I wanted to have this conversation with you. So I own my practice, and my practice is geared towards teenagers and teenagers. I'm also a parent of a teenager and a teenager. So pray for me because this is my world. And your survey is so interesting because, and for my audience, like I love storytelling, so I'm gonna be transparent. So I see a lot of students who go to Hoover City schools. And I recently ran into a pickle because I have a student whose academic schedule is rigorous, but her mental health is like just as rigorous. And the school is actually not allowing outside therapists to come in. They are not allowing virtual sessions. And so I think that as a clinician and as a parent, that is a huge barrier to our teens in the mental health care that they need. Like you said, if a teen comes to school hungry, if they come to school and they've been up all night and their basic needs aren't met, then everything else kind of like falls to the wayside. And so I guess the question was already asked, like, how can we do what you did in Fairfield in these school districts that feel like they already have everything? Like, oh, we have a mental health coordinator. Oh, we have this and we have that. But they're not letting the people who actually can do it.
So I think that's where having a coalition is important. I think that's when finding, as my grandmother would say, like-minded, like-hearted people is tantamount. It's very important because, like, I am not a mental health professional. I am a parent. I am an advocate. I am the kind of person, I call myself a linchpin. I'm that person that when you say, oh, Miss Adrienne, we need to have something for young people around vaping. Okay, hold on. Let me call some people. I know some people. Let's get this together. Let's put together a workshop. Let's put together a session for them. Let's take this into the school if they'll allow us. If not, there's a church that has a fellowship hall. We'll go there. Finding resources and things and building that coalition of people that can say, we're going to address this issue is important. Right. I know a lot of times we've heard, and I'm going to just say anecdotally, that a lot of times I've had some pushback in some other school districts because a lot of times I would feel like you don't really want to know, in a sense, because then it's a really big thing for you to address, and you may not be fully equipped to address it. But to me, 100%. That's when the community steps in. That's when you have those people who say, no, we're going to do this for our children. And I think that's where you may have to target thinking of building those coalitions, having those champions, and understanding that there are lots of people that think the same thing and are going through the same thing that you are with your personal, with your kids or with the children that they see in the school systems.
Yeah. Okay. I like it. What are some other barriers that you all ran into, like in your data collection, or what were some things that really stood out? So we know on our end that like depression and anxiety increased during COVID because of the isolation, because of this like worldwide pandemic. There was such an effect and just this like overwhelming sense of doom. Were there any other like interesting findings that you all found?
We found that a lot of our young people really leaned on each other during this time. There was a lot of comfort in them having friends that they could turn to and talk to. And a lot of that, I think, also made a lot of parents and those of us that are kind of in that stead for parents that are not able to cope with this, it made us step up and say, Mom, so and so's having a bad day. She was talking about cutting, and I don't understand what that means. That prompted me to go and find someone and say, hey, I have a young lady I know of. She's experiencing some cutting issues. How do I deal with this? How do I talk to her parents? And it was a connection that was made in that way. I think that our kids really, in a sense, relied on each other during that time. And that was good. And some of that was not so good. But I think for a lot of them, that was their only outlet.
Okay. And so, what can parents and teachers do to kind of come together to kind of bring your survey and what you guys stand for? Like, what can we do together to put that to light?
So you're always welcome to join the Birmingham Coalition for Student Mental Health. We meet monthly, and this month in particular, we had some discussions amongst our group. We share resources. We share, and when I say resources, it's not just, oh, here's an article or here's something that's going on. Like, okay, this is a workshop that's happening for young people, or this is something that I heard that was a great way of a coping mechanism that you can use with your young people. We also make sure we talk to those that are decision makers and have them be involved as well. There are several people within our coalition who work directly in the schools as state mental health coordinators. We have others that work in private practice. We have a lot of parents like myself. We have school counselors. So I think if you would like to join the coalition, you can send an email to birminghamstudentmentalhealth.com, and we would love to have you there. And the thing is, we don't want to be exclusive for the work that we do when it says Birmingham. This is something that we're thinking of, a model that can be replicated throughout the state, because we want to make sure that every child has the support that they need in school and out of school.
Okay. Does the audience have any other questions or comments? I see a whole lot about mental health days. Let's see. Mental health days are needed for teachers as well as students. We as educators have to be mindful of the things we say and limit our conversations in front of students because they don't know who hears their comments. That is very concerning, Pamela, because as a clinician, that gives me the impression that sometimes students nor teachers feel like school is a safe place.
Mm-hmm.
Right. And so we look at this as we need to hold space and we need spaces to be able to be held. And that is concerning. So what can we teachers, what do you guys think they can do to increase or even introduce mental health days into school days? That's a question for the audience. Burnout. Burnout is real. Burnout is 100% real. Okay, mental health days can prevent this, yes. And I don't know, Adrienne, like I'm the parent who like if my kids say I'm tired and we have a freshman and a sixth grader and they don't feel like doing something, we're just like, okay.
Yeah, I'm a lot like that too.
I'm
I
like,
think the
right.
other thing, I think the other thing that just talking from a parent perspective, that I do with my daughter is we make sure we allocate time that is no electronics, no phones, no TV. When she comes to talk to me, she has my full attention. So whatever I'm doing, I cut it off or I stop. I turn away from my screen if I'm, working or something from home. Because I think giving our kids full attention is also a way of building that trust with them to say, okay, I'm listening to you and I want to hear what you have to say. So it's little things that we can do at home, and even in the classroom that really um, will help a child understand that we are there for them, that we're there to support them.
I like it. Okay. I have one more question for the audience. As we kind of say bye to Adrienne, it was so good. As we kind of segue out, my question is to self-care. So what does self-care look like for you all during your school day? Do you practice self-care? What does it look like for you outside of school, before school? Because you may not have your mental health days, but there are things that you can do to be mental health conscious and to just give yourself a little pockets of happy, like I like to call them, every day. So, to my audience, what does self care look like for you? Okay, while we're waiting. So, my self care looks like I wake up early in the morning. I'm an early bird from that, this or that. I also go to the gym every day. It's scheduled, it's blocked off on my calendar. I am very protective over it. I do not bring work home in the evening. I do not see clients after I leave the office. I listen to murder mystery podcasts. I know it's crazy, but true crime is my heartstring. And so, those are some of my self care practices. Adrienne, what are some of yours while we're waiting for the audience?
So I actually have training in mindfulness-based stress reduction. So one of my favorite things is I go in my office, like if I'm at work and I'm having one of those days where my email is exploding and I'm like, I cannot do this. I shut it off. I close my door and I set an alarm on my phone for 10 minutes and I'm just quiet and still for 10 minutes. And sometimes just that 10 minutes will help you recoup and then you can go back to what you were doing. But you need that as we used to say woosah. I need to woosah for just 10 minutes and see if that helps. With my family, I'll tell you, we have a habit of before you go to bed, about 30 minutes or so before it's bedtime, cut off the TV, shut down the phone, just be really quiet and still. And then, yes, electronics have kind of taken over our lives, but thinking about being quiet and being still and just kind of giving yourself that grace and that moment to say, I am not going to engage. I'm just going to be within myself. I'm going to pay attention to my breath. I'm going to pay attention to my feelings. And that's it. And that works really well just for that moment.
Ooh, okay. I meditate and listen to gospel music to clear my mind. I love that. I listen to a little trap music sometimes too. Mm-hmm. So, pre-K, bless you. Self-care during school hours is gathering the children on the carpet and we practice taking deep breaths. I love that.
Mm-hmm.
That is wonderful. Uninterrupted listen. Don't mess with me while I'm trying to eat my food and fuel my body. And catch up on an episode of a show. Right? Meditate and listen to music. I love that. Okay. Okay. Anybody else? Meditation, deep breathing, and exercise before work. There is so much research behind exercise and mental health. So much research behind it. Okay, I love it. Meditation every morning on my drive and I work with gospel music. I love it. Tammy, good. Sleep journaling, really make time for relaxation. I love it. Now, all of my people who are answering, is your self-care consistent? Because that's a huge part of self-care. I love it. Ooh, turn off the lights and take a break. Very good, Dexter. Very good. That is lovely. Gospel music. A lot of music people. You guys are doing great. I love all these comments. Okay. And while you guys are still answering, we do Black Women's Mental Health Institute. We did create a resource guide. It is full of mental health resources at the national level, at the state level. There are some mental health terms for you all to know because children and teenagers will come in school and say that they Googled something and they will come to you and tell you they are anxious, depressed, bipolar, schizophrenic, and autistic all in one. And it's like, okay, friend, maybe you're just having a bad day. So we put some common words to know in there. And all the way at the end of the guide, there is some self-care things that define what is self-care, how can we practice self-care, things like that. So all right. Any other comments? If not, we are going to say thank you once again to Adrienne and goodbye. And we are going to get ready to take a short break. But if you guys want, you can continue your comments in the chat and we will answer them as best we can. So thank you again, Adrienne.
Thank you.
Any other questions or comments? Okay. Is there any other types of self care that other people do? So, when we talk about self care, there are actually about 7 or 8 different kinds of self care, and that goes from social to spiritual, environmental self care, financial self care, physical self care. It's a bunch of self care. So, aside from meditation and listening to music and journaling, is there anything else interesting that people have found that works? That you're kind of like, huh, I never thought about that being self care. I'm very big on space. I'm very big on smell. I'm very big on like music and just how my environment is set. So I light lots of candles. I do a lot of essential oils, very low light, all of these things. So what are some things that you guys have found have worked that are not like your ordinary self-care practices? I think our technology is doing all the things. Okay. All right. So we're doing a lot. So while you guys are thinking about your self-care practices and we're going to take a break, we're going to do a giveaway. Yes, a giveaway. You get things. People are going to win things. So we are going to spin a wheel and announce a name, and that person is going to win a prize. So I'm going to bring Dr. Nadia Richardson back in, and she's going to do our giveaway, and then we're going to take a 10-minute break, and we'll be back to talk to Dr. Nelson.
Okay, so everyone who is registered for today's summit your name's been placed in a digital wheel. So what I'm going to do now is spin this wheel and give a prize away. So let's see whose name is going to pop up. The wheel is spinning, and we have, is it Keisha Sneed? Are you on the Zoom? Are you on our webinar today? If you are, go ahead and say, yeah, that's me in the comments, because we need you to be present to get this gift. Okay. Let's try another name. Alicia Jordan. Your name is popped up on the wheel. Lizzie's like, I'm here, pull my name. Okay, we may have to do this a little different. Make sure. Keisha's like, I'm here, pick me, pick me. I don't know. You know what? We may have to go back and just put the names of people who are actually on the call and make sure that your name is selected. So Lauren, you can come back in and just let everybody out for a quick break.
So we're gonna take a quick 10-minute break. Go do all the things that you need to do, and we will see you all back in about 10 minutes.
Okay,
All
we're back.
right.
All right. So after much chatter on the chat box of people that are like, look, bump those other folks that didn't show up. We need to get a prize. We have updated the wheel. So now the only names on the wheel are the people who are present. So what we're going to do right now is spin this wheel and see who we can give a prize to this morning before we go on to the next thing. All right. So what we have now is Angela Waller. Angela Waller, say if you're in here, just say that's me. I'm it. Are you here? Are you back from the break? Hey, Lizzie's rooting for you now. I don't see an Angela yet. We're gonna give Angela a real quick second because we know you are on. We know you've logged in. What we're gonna do is spin one more time and give one more prize before we go on to the next speaker. Angela's about to lose her prize. Guess whose name just came up? And I wish I could share my screen so y'all know that I am not doing this. Congratulations, Lizzie. Lizzie has got herself a prize. Lizzie, we're going to send you a copy of one of JacQuan Winter's books. It's a book on emotion. So what I'm going to need you to do, and I'm going to put it in the chat, is to email your name and mailing address, and we will make sure to get that to you in the mail. We're going to do one more. I don't know what happened to Angela, but we're going to do one more, and then we're going to go to break. We'll see who we can get here. Sorry, Angela. Okay, looks like Ilona Washington. Ilona Washington, are you here? Do we have Ilona? Folks are like, me. Oh, hi, Ilona. Yay, there you are. Congratulations. Thank you so much for being here. You are also going to get a copy of JacQuan's book. We'll make sure to put that in the mail to you. Just go ahead and email info@bwmhi.org. Send us your name and your mailing address. We'll make sure to get that to you. I'm going to step away. I might step back on at the very end to give one more prize away. Thank y'all for being here. We're going to pass it back to Lauren, and she will introduce our speaker, Dr. Artie Nelson.
Hey, all right. So congratulations to our winners. All right. So Dr. Artie Nelson, I actually had the pleasure of hosting another panel and meeting him this summer at our mental health summit. He is an amazing child and adolescent psychiatrist. He has tons of wisdom and just a very kind spirit, and he does amazing work. And so I am more than honored to introduce him and bring him on for him to give you guys some good info. So, hey, Dr. Nelson.
Hey, good morning. How are you? You got me.
How are you?
Good. You got me on right before lunch. That's always a challenge, isn't it?
It is. All right. I'm going to turn it over to you.
Okay. We're going to try to do this little media thing here. And I was tutored this morning on this. But we're going to talk a little bit about my role as a child and adolescent psychiatrist working with kids. So let's see if you may not see me, but you should be able to see my slides. Let's see. All righty. And we'll do the slideshow here. Can everybody see that? Hopefully. And they'll let me know if they can't. But what I wanted to do is just talk briefly about mental health as far as in the educational system. But I'm going to give you a little bit of my background, I am child adolescent psychiatrist. Started out as a pediatrician and noticed about second year into my training, seeing a lot of children in the emergency room with suicidal ideations, had either taken an overdose or had cut on themselves. And as a pediatrician, you got 5-10 minutes just to kind of take care of whatever the wound was or to pump their stomach, that sort of thing. But I didn't have enough time to talk to them. So I got frustrated with that and started hanging out with some child psychiatrists that were due to the consults for these kids. And it was just amazing to me how many kids very young were actually contemplating hurting themselves for a variety of reasons. And this was in a city, a town, a state that has a pretty good understanding of mental health as far as the less stigma, Los Angeles, but still a lot of difficulty with mental health for children. So what I want to do, there has, and some of the speakers before have certainly mentioned that there's been an increase in depression and anxiety, some of that with young people during the pandemic, but a lot of people are not aware that it was actually rising much earlier than the pandemic. The pandemic was like this sort of catalyst that brought it forward. But we have seen just amazing increases in anxiety and depression with young children and younger. You can see on the slide here, suicide is the second leading cause of death among ages 10 to 24, and increase in substance abuse among adolescents. And a lot of that, again, was increasing during the pandemic. In the area of diversity, we've seen a significant increase in the African American and Hispanic population of suicide and anxiety and depression. Let's see. There's an increase in awareness and a decline in the stigma, and I see that even in the Southeast. At one time when I first moved here, very difficult to get people to come in of all races to talk about their mental health. They would come in, say if I did a back to school physical for a kid, they would come in and do that. But if I asked questions about mental health, it's very difficult to get them in. Social media must be addressed. I put that up there because Surgeon General has recently said social media is certainly contributing. It's not the only cause of the distress, but it's contributing. And I'm a storyteller, so I always will throw in stories. This phenomenon has been going on for a while. I was at a conference in La Jolla, California, and it was actually we had talked about self-care. This was a self-care, which is called a weekend within. And we meditated, we learned to eat better, exercised, and talked about ways to de-stress. I would highly recommend it. It wasn't cheap, but it wasn't super expensive. You spent the weekend within, learning how to get better in touch with yourself. Long story short, a lot of the participants were actually from the Northern California area, even though it was in Southern California, and they were actually working for the social media companies. Some of them had just started, Google, Facebook, that sort of thing. So this was about, I want to say 10 years ago or so. And sitting down having lunch with them, they talked about the phenomenon of how their job was to get your attention addicted to these various media forms, social media, your cell phone, just in general. And it was just amazing to me that a lot of them did not let their children use social media, or it was very limited, but their algorithms were to get you hooked. And as we can see now, a lot of people are hooked, and it's very difficult to pull that away. So I just wanted to throw that in. But the positive trends in youth mental health, they are more aware. They are at least looking up things and seeing whether they have some sort of mental distress or mental illness. And a lot of them do sort of latch on to whatever's popular, ADHD, bipolar, or they may think they're schizophrenic. So a lot of that we have to sort of, as the professionals, kind of tease through that and help them understand that anybody can have certainly stressful days. I'm going to move on, and I'll show you a video at the end, which I think will be very eye-opening. And some of the earlier speakers were talking about how can we bring this into the schools. I've had the benefit and was blessed to see a couple of things in Los Angeles, and still go out to Los Angeles in various parts of California to consult and talk with colleagues from the past of what's going on there and what's new in the area of child mental health. But one of the things, building relationships with students, and this was said earlier, educating yourself about mental health, but also building the relationship, also having that rapport with a student and seeing how you can connect. And you'd be surprised. Again, I'm a storyteller. Every patient that I see in my history taking, particularly even also adults, who was the most influential to them as they were growing up, believe it or not, it was their teacher. Hands down, the most times when I talk to people about it, it's their teacher. I know for me personally, it was a teacher, first grade teacher, Miss Wellborn. I can still remember her name. And most adults, when I see them for therapy or adjusting their medications, they remember the names of their teachers. So again, shout out to teachers. You guys are on the front lines. Highly respect. I have educators in my family. So, shout out goes out to them for sure. Celebrate diversity. Every kid presents differently, certainly from different cultures, to build that rapport, work with them, try to understand, have a general curiosity about their culture. If you're from a different culture, have a general curiosity about them, even about their region. There are people that are from rural Alabama that think and act differently from the city or urban Alabama. So keep that in mind. I think a lot of people don't realize that there's different ways and different cultural norms and things like that. So celebrate diversity. These are some of the resources that I want to touch on, and then I'm going to go back to that video if I can and show that for you, and then we can open it up for discussion. Again, Teen Line Online. A lot of people may not be aware of it. It's out of Los Angeles, started in the 80s, believe it or not. Dr. Elaine Leader, psychologist, noticed in her research that teens were able to talk to their peers more easily than they were to their adults, even their teachers, but certainly their peers was number one. And she came up with a telephone line at that point, to talk, to train teenagers to be listeners. It was a community effort. She had a grant, and it was called Teen Line. And from 6 to 10 p.m., you could call with any problem you had. It wasn't just a suicide line. It was a teen line for anything. You had bad grades, your parents were arguing, things like that. And it was very eye-opening for me. Training in child psychiatry, we would rotate through the teen line and spend an evening with these listeners. They were supervised by a mental health professional, and you'd be amazed, kids calling from all over the country, sharing their stories, getting advice, getting referred to other, whether a counselor, if it was serious, obviously to the hospital, that sort of thing. But they felt much more comfortable, talking with other teens. The other thing I found out was that with this teen line, the teen listeners became very interested in mental health. They were emotionally healthier by participating in this. And again, they got community service credit for it. But amazing kids. A lot of them have gone on to be therapists, psychiatrists, psychologists, or just working in nonprofits, things like that. But been around for many years. I suggest it to all my teenagers that I see. It's a 1-800 number. They now have Teen Line Online, where you can just email to the listener. And you can also, like I said, call still, and also text. So they've updated their system to have that in place. Very excellent. NAMI obviously is a resource for many people. The JED Foundation is one of the foundations I found that was related to a family that lost their child. American Foundation for Suicide, and a crisis text line. These are all out there to help with establishing information for mental health. And then for teachers, you can direct kids to this to get help. I want to go back. And like I said, I know we don't have a lot of time. I want to show this video, if it works, and then open it up for questions. About a 5-minute video, and then we can go from there. Let's see if I can make this happen.
Children today are much more stressed. There's more problems for children and fewer resources.
It's more likely if you're in high school now that your parents will have graduated than will you.
We're losing 25 to 30% of our young people every year.
Today, 50% of teachers leave after 5 years.
The dropout issue and the education issue has been called the civil rights issue of our time. We're going to win or lose the battle for the future of America at the Schoolhouse Board.
There was sort of a silent distress. Children were not graduating. There was a lot of depression, a lot of suicide, discontentment. So we started the Mind Up program to help children succeed in school by way of reducing stress, making them more self-aware, creating more optimism.
Mind Up is an evidence-based program that focuses on social emotional learning. It is designed for pre-kindergarten through 8th grade. It deals with positive psychology, mindful education, as well as neuroscience.
We created a curriculum that has 4 different parts to it. One is that they learn about their brain. They learn how to quiet their mind, and they quiet their mind by doing brain breaks. Then we do being mindful of our senses, which helps them focus. And we do our place in the world. We do gratitude journals and happiness savoring.
I'm feeling grateful right now for my mom in particular.
I'm grateful I have a sister.
Teaches children, first of all, about how their brain works and helps them to be mindful of the different things that they do.
What can we write instead of prefrontal cortex? Yeah, P, F. Okay.
When I read them stories, it's the most interesting part. They'll tell me if the characters are using their prefrontal cortex or their amygdala, and it's really great to see that.
It really equips children with tools in which they can reduce stress in their lives and ready their brain for learning. Children who are less stressed are more happy, and happier children not only do better in school, have higher academics, as well as more motivation, they also are more caring and empathic individuals.
This actually raises the bar for them, where they are more aware of what's being asked from them and not frightened to take an assessment.
It works with the senses, and we know approaching the senses is a really good way to help children focus their attention, calm down, and it's very easy for them to access their attentional skills that way. What they're doing when they're doing this breath practice is they're regulating their physiology. They're learning that they can control something about their physiology, and in that process, calm down.
The first things in there, such as the breathing and the mindful tasting and sensory interactions, is a way of beginning to develop the part of the brain for inspiration, creativity, perseverance.
I like to do it in the morning, and it does get them calm and ready to start the day.
It gets me ready for working, and it calms me down. I do it sometimes at night to help me fall asleep.
Well, there's all sorts of things that develop in a positive direction. Physiological health, like medical well-being. The way your mind functions is with more clarity and balance. Kids who are practicing mindfulness are actually learning more and doing better academically. I think the reason it does is it allows children to know their own mental experience.
The students are ready to learn and are actually capable of retaining what they've learned. I think that what Mind Up is going to offer us a more systematic approach to developing these skills.
Once it's a test time, I just do 1 or 2 of those breathing exercises, and it helps me remember.
As 21st century learners, it is imperative
that they are optimistic. It is imperative that they understand that if they're going to compete with a global community, they must be resilient.
For teachers, the program has been extremely good, including manage their own stress. They're learning actually to take that break with the kids, and it's very beneficial.
Teachers need a lot of support right now. They need skills to help themselves and at the same time, tools to help their students calm down. And the more both of those two things are happening, the more effective their teaching will be.
Even when I'm lesson planning, I'm more mindful of what I'll say to the children. I'm more mindful of what they might say back. And I'm especially mindful of giving voice to their thoughts and their feelings.
A lot of them tell me that they taught their parents the breathing, and I think it's going to extend from the classroom into the community.
I've taught it to my mom and dad, and if they get into a little fight, I ask them to do it, and after, they're not mad at each other anymore. I taught my big sister it because she gets really frustrated really easily, and it just makes her calmer, and it makes me happier.
I noticed a difference in the students, a difference in the teachers. Their voice, they don't raise their voices at all. Their classrooms are always calm with students working.
We need people who can think outside the box, who can think creatively, who can solve problems in a new way.
I think we'll get there. I think we'll get there.
I know we can change a lot of children this way. A positive child is a child who can learn and can look to the future.
So I wanted to share that. Again, it's called Mind Up, and it is a very interesting program. I was introduced to it a couple of years ago. You can go online and find books and tapes about it. It's all over the world, not just in the U.S. I've seen video from England and other countries. So keep that in mind. Another thing I wanted to touch on, I know people were talking about how to de-stress and how to do me time. I would suggest we look at music also. I do a presentation on music. I got some information from a researcher in Texas on music, and it was very, very informative. Music, for some people, can actually work better or just as well as an antidepressant or an anti-anxiety. So keep that in mind. It's amazing what music can do. And we've all known that. I noticed some people were saying in the comments about listening to music on the way to work, listening to their gospel music and meditating. This researcher suggested taking your playlist of about 7 songs. They don't all have to be in the same category, but have a morning uplift song, an afternoon, midday, evening. Come up with 7 songs. If you're stressed out, whatever your favorite songs, doesn't have to be, and you come up with it. I've started doing it with my patients, and you'd be amazed of how they said they don't have to take their anti-anxiety medicine as much, or they want to get off of it because they realize they've rediscovered music. And we've all known that for a while, but it's interesting how that is resurfaced. This was a 2-hour presentation. The presenter even was in tears about how he had to get back to his own native music. He was from India, and realize how helpful and energetic and how it made him getting back and doing this research. So keep that in mind. Another tidbit I would leave you to is certainly the hero's journey I talk about a lot, that make sure you let kids know that the trials and tribulations at times, if certainly the trauma and things like that are very significant and have to be approached, but some trials and tribulations, if you don't do well on a test, it's part of your hero's journey, your way of getting back to yourself to come back home and tell your story. And a lot of kids have really accepted that when I talk to them, about not doing well on a test, or they didn't get into the position on the football team that they wanted. Maybe there's an answer there. Maybe there's a reason why, but don't give up on your dream. So I want to leave you guys with that. And again, my shout out is to teachers. You have a very important job. I'm willing to answer, whatever questions you have, and turn it back over to our moderator. Thank you so much.
Yeah, thank you, Dr. Nelson. Okay, do we have any questions in the chat? If not, I actually did have some questions. So the video kind of talked about this brain-body connection, which is key. I talk about the brain-body connection a lot. So can you kind of tell us why that brain-body connection is so important and how it affects, conditions like anxiety and depression, specifically in children and adolescents?
Yeah, you have to look at, certainly children their brains are still developing. Recent neuroanatomy and neuropsychology has shown that it really is not fully developed until, and this surprises people, 25, 27 years old. So you even explain some of the odd behaviors of college students sometime of what they do. But the connection between the brain and the body is very, very important. We know that stress can lead to physical illnesses, for instance, hypertension, peptic ulcers, chronic headaches, things like that. So we know it's very, very important to have that connection. But you have to practice, and it's a big talk about mindfulness now, but it's been around for forever, for a very long time. A lot of cultures really practice where you are in a situation and let that your heart, as they say, and your mind kind of connect. And a lot of people don't realize that, but there are actually the same cells that are in your brain that your heart actually feels emotion too. And, people say, I feel that in my heart, or that person has a good heart, that sort of thing. But that is an actual true scientifically proven phenomenon. So I hope I answered your question. Yeah, the brain and body connection is very, very important. We're seeing a lot more of that.
Yeah, good. I love the answer. Okay. And then the second, I think the most important thing, secondly, that I saw in this video was resilience, right? So resilience is always one of those things because we hear so often, oh my God, kids are just so resilient. Like they'll get over it. They're resilient. You're moving, you're whatever. And so how can parents contribute to developing their children's resilience and even their own resilience as parents, caregivers, and teachers, so that when academic and personal challenges come up, the response is better?
Yeah, a lot of it is teach by example. I mean, as you saw in that video, the Mind Up program actually helps the teachers besides the students. So they practice mindfulness and calming down and not getting so upset. And they said the teachers are not yelling as much, not upset as much. And anybody can have, a bad day, as you talked about earlier. But really, it's about being in touch with yourself and seeing, kids are resilient, but they also still struggle with a lot of things that they keep internally. And a lot of times you don't know that until much later. Make the space comfortable for kids to be able to share how they're feeling and be a good listener. A lot of kids will tell me my parents don't listen. They cut me off and say, oh, you need to do this, or, go there. Don't let that person get to you, particularly when it comes to things like bullying or comparing themselves with other teenagers, either by academic grades or how they look. A lot of that they may not share. Again, I have turned kids on to the teen line, but I would also suggest there's a wealth of information about mindfulness, getting in touch with your own sense of self. And a lot of it is online. It's free. I always suggest the Calm app is a very good app to get on, that just sort of, if you're having a day and you need to calm down. So it helps. And as you can see, the Mind Up program has been really helpful. My biggest goal is to get something like that in all the school systems. We certainly need to talk to Birmingham school system, Hoover school systems, all these school systems, to get something like that. It's not super expensive, 5 minutes out of the day to hit that little bell and have kids take a breathing moment there. You can almost tell when you're upset, your breathing gets shallow and you're breathing, really fast, and your heart starts to beat. And if you settle down and, you can count it out, 7 breaths in, hold it for 4 and 8 out, it really can settle you down. It all sounds, oh, yoga and all that kind of stuff, but it really does work. We're breathing individuals. I hope that answers your question. Okay.
It did. Thank you. All right. We actually have a question from the audience. So Lizzie wants to know if you think students will be more willing to call a hotline for help or speak with someone face to face.
More likely with the teen line that I worked with, more likely to call. It's less, it's still personal, but it's less personal as actually the face-to-face meeting. And these kids, I mean, the training they went through to become listeners, I mean, it was almost like a mini licensure to become a mental health counselor. It wasn't just a few little classroom. I mean, they had to come and they had to participate and they had to get reviewed by a mental health professional to be able to be a good listener. But to answer the question, yeah, it's easier. They respond better to their peers than they do any adult. And it's nothing that you're not doing. It's just that, we know that peers are very important to almost every age group in the different sections as kids grow up. And they're going to listen to their peers, good or bad. But I've had kids say, yeah, I can talk to my friend better than I can talk to my mom or, my dad. And that's just the way it is. A lot of times we see that, but we kind of want our kids to be, you can come to me and tell me something. But a lot of times that just is not the case. And so I would say, yes, speaking with someone, say on a hotline or like I said, this teen line can be very helpful.
Yeah, thanks for your question, Lizzie. And also like piggybacking off of Dr. Nelson, because I see teens and tweens in my practice every day. And someone asked a question earlier about just the stigma around mental health. I think that it's super important for us to let our children know that just because you go to a therapist doesn't mean that there is something wrong with you. So going for your mental health is just like going for your physical health. It's just as important. And so it also allows them to kind of take this like preconceived notion that, oh, this doctor is going to come in and they're going to tell me to take a medicine and they're going to tell me to do. And so I think that's super important. And so that's my next question, Dr. Nelson, is how do you handle parents and children who do have these like stigmas and these fears, especially for you because you do medicine. And so how do you handle that when it's needed but not necessarily wanted?
Yeah, it's a rapport building process. And I think the fact that I did pediatrics first also has helped. A lot of times we don't talk about medicine on the first session or even the second session. And a lot of parents are surprised because they assume you're going to a psychiatrist, they're going to put you on a pill and you're going to be better. I still do play therapy. I've been trained to do play therapy. I do talk when they're old enough to them alone after talking with the parents together. And it's a matter of just sort of educating the parent about what medicines can do and what they can't do. I promote exercise. As you had said earlier, there's a lot of research coming out about, exercise. I even have a little prescription pad that has how many push-ups to do and how many, and it's written on a script pad, just like it would be a medicine to do it. And it really does make a difference. So a lot of times the first thing is not to put them on a medication. There clearly are kids that need something, but a lot of times it's not the first thing you want to go to. A lot of times they've been to their pediatrician and the pediatrician say, well, this kid needs to be on ADHD medicine, right away. And you find out the kid is bored. And a lot of the behavior in class is that they're not, the information is boring to them. They're actually much smarter than they even thought. And the kid is bored. And when you start giving them more challenging work, they settle down. They're not walking all over the classroom. I would suggest just to look at it. It's on Prime. Have you seen it's a TV series called This is High School. It's actually a Canadian high school that they put video in. It's called This is High School. And it's on Amazon Prime. But it shows adolescent behavior. It starts probably 8th grade through seniors in Canada. And it's number one, it's interesting that you see the Canadian kids have just as much issues as American kids. They dress alike and all that stuff, but also it just shows you the same teen kind of issues, the back and forth. Somebody's talking about me. What amazed me about the show is showing how much they depend on that device, and they're constantly on it. I'm not sure the rules in Canada schools, but they let them have their cell phones just up and down the hallway, and they're always, and a lot of it is about so-and-so said something about me, said I was fat, said I was stupid. So it's good to see for parents to watch it and just sort of see for anyone to see what kids are going through. Because sometimes once we're out of high school, we're kind of removed from that and we try to understand it. But if you're not a teacher and you show it shows what teachers are trying to do in that setting to help kids have higher self-esteem. And also I would highly recommend it. So yeah, This Is High School. I think it's on Amazon Prime.
I love it. Okay. I wrote it down because I'm going to watch it today. Also, I'm not going to name the school that my high schooler goes to, but they can absolutely have their cell phones. They can have them in the hallways. Some teachers allow them in the classrooms, and he actually walks with an earbud in all day listening to music because the overwhelmingness of his high school, because it's a big high school, he says it overwhelms him. And so he listens to classical music and cinematic music all day.
Yeah, and we're seeing that, as we said earlier, music is very helpful. I think more schools need to find a place for that, and certainly, instead of handing out detention and things like that, maybe using music, using some of this mind up, topics and things like that, and mindfulness may be quite helpful to cut down on the behavioral stuff there. So I think we need to start looking at, as Goldie Hawn, which I was surprised when I found out about, Goldie Hawn had this foundation for several years, that she said, it really was an eye opener to see how much we are losing kids to suicide and self-harm and all that kind of stuff. So we really need to be open-minded about some new stuff and have open mind to try new things, because obviously with the rates going up, it's not working. Something's not working. And we got to work together to try to figure out what's going to work the best.
100% agree. And for my teachers, us on the mental health side, we also, have seen increases in eating disorders among children and adolescents, anxiety, depression. My clients have come in and they are now using what they call maladaptive daydreaming, where they literally go into another world and disassociate because the real world around them is just so chaotic and so out of control. And so my last question, Dr. Nelson, is what can teachers do? Because these are our frontline workers here in this training. What can they do to kind of foster this balanced classroom environment for those kids that are different? Every child is different. So for those kids who are challenging, or for those kids who are bored and you only have 50 minutes in a class period. So how can teachers create this sort of academically and mentally balanced classroom?
It's a challenge, and I've talked with teachers also. I think, and when I mentioned earlier, when you asked adults who was most influential, it's either a coach or a teacher that was also their wrestling coach or whatever. A lot of it is making that classroom the most important part of their day. Each teacher, whatever it's math and all that, and they almost have to be an entertainer to be honest with you. I've seen that a lot out in California. That it's the entertainment world, but a lot of teachers animated, really enjoy the subjects. You'll see on this, and I don't have any money behind this TV show in Prime, but you'll see on that This Is High School, you'll see some of the teachers, you can tell the ones that are really into loving what they do and love kids and all that kind of stuff. I think it's really challenging. Don't get me wrong. And I'm not trying to make light of it, but you really have to make that 50 minutes very special to them, because they're used to being entertained. One of the Google specialists told me that's the purpose of social media and having you look at that screen, is to keep your attention. And it's very hard to have something like that to keep your attention and then go to a classroom and somebody's teaching algebra and they just writing on the board, and and in 15 minutes, you've lost them. What is the average attention span is now 8 minutes in America. So how do you get people engaged to get them to, really pay attention? So it's a challenge. I don't want to make it seem like it's not accomplishable, but you really have to be able to get that kid's attention. If a kid that singles out, they're truly kids that are ADHD and are not just bored, and have those kids referred to a mental health professional to get help. But there are a lot of kids that are just saying this, I just don't like math, and this math is being taught very, matter of fact, and the teacher doesn't look like they like it either, and they just get into their day. And kids are very perceptive. They know when somebody likes their job. They know when somebody likes them. And we kind of put that on the side and don't think so. But I've had many teachers say, yeah, that kid did pick up on this other teacher not liking, or the substitute that came in really didn't want to be there and just was going through the motions. Kids pick up on that. So I think we got to be more aware of ourselves in order to help the children, because they're constantly looking at us for guidance. Be the example for kids. Don't show them bad examples or inappropriate examples. Be the examples to show them how to be calm and how to handle that. And again, the information is out there. We don't have to reinvent the wheel. Like I said, music, mindfulness, getting enough rest, exercise, all of it's out there. We just got to incorporate it into that. The arts. I know one person also asked, I think you had asked, any other things we can do to help with our own mental health day. Art is very important. Take a musical instrument that you never thought you could play. Go, take guitar, take some piano lessons. A lot of that stuff is now free at the YMCA. You can go in there and somebody's volunteered to teach people how to play piano or guitar and all that. All that can be helpful for you. And if you're better, then you pass that on to other people. So I would share that part too. Excuse me.
I love it. Okay. All right. Well, we are going to thank Dr. Nelson so much. Always a pleasure. If anybody has if anybody has any other questions for him, please pop them in the comments. And so we're going to let Dr. Nelson in, and then we're going to wrap things up.
Okay.
Thank you, Dr. Nelson.
Okay.
Let's see. Perfect. All right. So we are getting ready to wrap things up. Oh, thank you so much, Samantha. People are saying that was very informative. Thank you. So with about 10 minutes left, does anyone have any questions for any of our panelists or myself, or anything about Black Women's Mental Health Institute and the things that we do? Again, this is a teacher training and it's all about you. Hats off to you all. It takes very special and gifted individuals to be a teacher. And so we want to make sure that if no one else tells you today, you guys are seen and you're heard, and there are people who are on your side and willing to do whatever we can to help you. I enjoyed the information. Awesome. This was great. I love it. So as we kind of close, can you guys tell me one thing that you learned today, or one thing that you found interesting for today? Or if there are any other topics that you would love to see? Will this event be available for teachers to watch on their own time, since today is a school day? Let's see. I believe we can. I believe that we can do that. And we also have our resource guide that we created that we will drop. And so it's a PDF. You guys can go and download it, keep it in your classroom. It's just like a little quick, 15-page handbook. We're going to do another giveaway in a few minutes. Let's see. Keep the comments coming. Thank you. I really enjoyed. Thank you so much. I'm interested to know what grades you all teach, what subjects you teach. I'm interested to know any of those things. If you want to drop it in the chat. Thank you. Good job. Oh, thank you. Any other questions for anybody? Okay, let's see. What else do people have? Did you guys think the training was too long, too short? First grade teachers. Ooh, bless you. They're interesting little ones. I love those tiny humans. Oh, we got a principal in the house, third grade. Let's see. Thanks. I was not aware of the pervasiveness of mental issues currently impacting post-pandemic education. Thanks and God bless. Yes. So the thing about that is we actually, so no data is really in real time. And so now they are coming out with all of this data towards mental health, which is why you hear a lot of people say, oh, teens are in crisis. It's because the data is just now coming out. But there have absolutely been spikes in a lot of things. And it's super important to remember too that like on top of being students, like kids are people too. And so they have their own world and their own things that are happening. So yeah, let's see. Great webinar. Thank you. Principal, early Head Start workers, high school. I love a high schooler. Oh, we have some counselors. Yes, Head Start teachers, more counselors. I love it. You guys are doing an awesome job. These mental health streets are rough. These mental health streets are rough. Coordinator and counselor. I love it. This is wonderful. I love hearing Dr. Nelson's yes. Oh, thank you. We are always open to new ideas. We also offer free counseling. And so I encourage you guys to go check out our website for Black Women's Mental Health Institute. Let's see. The music is an interesting thought. I stopped the students from listening music during instructional time. Okay, Lizzie, that's great, but maybe you could play it softly in the background. If you want to. There's a lot of like ambient music out. There's a playlist on Apple called Peaceful Focus, and there are no words in any of the music. It's just nice sounds. I actually had a client tell me about pink music and brown music. Like you guys know how we have white noise. She told me yesterday, Ms. Lauren, I listen to brown noise and pink noise. So that may be something to listen into, to look into. This is beautiful. Family service advocate. Okay, Brenda, you need a lot of self-care. Yes, I'm glad you got some time today to do some things. Okay, let's see. Any other comments, questions? Okay, so I'm going to bring Dr. Nadia in, and she's going to do another giveaway and close us out. I hope that you guys enjoyed today. I enjoy being your hostess with the mostest, and I hope you have a great weekend. So whenever Dr. Nadia is ready, she's going to come on in.
All right, let's go. So I do want to thank everyone that's been involved in this process. I would like to thank the media team in the back that you might not be able to see them, but they are completely on point. They've been spectacular. 66 Media, thank you so much for making this just a very easy process. Thank you to Lauren, you're a spectacular MC. Thank you to all of our speakers. We have 2 more giveaways, but before we go into that, I just want to remind you that the Black Women's Mental Health Institute and the Black Belt Community Foundation are here as resources for you. If you have any questions related to mental health, feel free to call us. We can serve as an advisory team for you. If you're looking for resources for yourself, for your students, for your teachers, parents, principals, counselors, administrators, you name it, reach out to us. We'll make sure that we connect you to the right people. There's no reason for you to kind of go looking for these things yourself. We are a clearinghouse of resources and information. Let us share them with you. That's what we want. We also want to let you know about a few events. Again, tomorrow is our Suicide Prevention and Awareness Health Summit that's taking place at Stillman College from 11 o'clock in the morning to 3 o'clock in the afternoon. There'll be some spectacular speakers, including suicide attempt survivors like Takia Blackman, who is founder of Black People Die by Suicide Too, who is coming in from the Washington, D.C. area, and Dr. Ashley Nash, who is the founder of Trauma and Revised, And she will also be speaking. And again, Mr. JacQuan Winters, who will be speaking, will have a lot of informational desks and resource tables available from different organizations, including the Alabama Department of Mental Health and Children's of Alabama Psychiatric Intake Response Center, and as well as Mott Watley health clinics will also have tables set up, as well as us. So you can come get lots of information about all the things that we're doing throughout the state. I also want to invite you to a couple of key events that we have coming up. We do have free mental health first aid training and free QPR training that we'll be offering from now until May. That's also made possible by the Black Belt Community Foundation. You will be added to our listserv, so you'll start getting blasted about that. I always say register soon because those seats fill up quickly. On March 1st, we will have a Women's History Luncheon that will be in Birmingham, Alabama. At the Botanical Gardens. We have a special guest that will be joining us from that event, a nationally recognized, nationally known guest. So follow us on our social media and listen out for our newsletter so you can find out more about that. And then I want to go to 2 giveaways. And here are the giveaways, right? One is on February 2nd, the Black Women's Mental Health Institute is going to be doing a book launch. We have had the great fortune of partnering with Dr. Stephanie Evans, who is a professor out of the University of Georgia, and she has written this beautiful book called Africana Tea, and she's done so with an artist and another author. I've had the great fortune of providing the foreword to that book, and that book is about Black women's wellness and the history of tea and how we use tea in our wellness journey. I would like to give a copy of that book away and also invite everyone to the virtual book launch, which will take place online on February 2nd at 11 a.m. Central Standard Time. Again, you'll get more information about that in our newsletter, but what I'm going to do is spin the wheel right now and give a copy of that book away. So here we go. The wheel is turning. I wish you could see it. It's really kind of a fun thing. And I'm going to put the website for the book in the let's see. Okay, we have Lisette Fletcher. You got a copy of Africana Tea. Lisette, are you here? To make sure you can claim your prize. Does everybody see her? Is she on? Oh no, Lisette, don't lose your prize. Okay, we'll give her a little bit of time. I'm going to spin it one more time. This next prize that we're going to give away is every July. How many of you know that July is Minority Mental Health Awareness Month? So every July we host, hi Lisette. All right, you know the drill. Congratulations. You're going to get a copy of Africana Tea. All you have to do is email your name and mailing address to info@bwmhi.org, and we'll make sure that you get that book. Every July, we host the Mental Health Equity and Liberation Summit. It brings speakers from across the country, as well as mental health advocates, educators, law enforcement, caregivers, individuals who are living with mental health concerns, artists, elected officials, you name it. They come to this event to learn about how they can support mental health equity and access healthcare in their communities and beyond. So what we're going to do now is raffle off a free registration to that event in July. So here we go with the wheel again. One more time with the wheel. Okay, let's see. Who is it? We have Tiffany Pearson. Do we have Tiffany? Tiffany, are you here? All right. We're going to give Tiffany a few more quick minutes. And if we don't have her, we're going to spin. Oh, there she goes. All right, Tiffany, you got it. you're going to get a free registration to our Mental Health Equity and Liberation Summit scheduled for July 11th here in Birmingham, Alabama at the Botanical Gardens. Just email your name and address so I can make sure that you are added onto that list. But here, I don't want anybody to leave today's webinar thinking that you're going to leave empty-handed, right? Every single person who is registered for this webinar will receive a code where you will receive 15% off of registration for our Mental Health Equity and Liberation Summit in July. So you will get that code along with the resource guide that Lauren created. We thank you for all that you do as educators. We thank you for your work in the community. We celebrate you, and we are here to support you so that you can foster the mental health and well-being of every child you serve, but also prioritize your own wellness. So thank you again. Y'all enjoy the rest of your Friday and stay in touch with the Black Women's Mental Health Institute and the Black Belt Community Foundation. You will receive a link to this recording so that you could share it with colleagues that were not able to attend. Have a great weekend. Thank you.